Hi, and welcome to Askimo TV. Talking today to Dr. Jake Sloane. Dr. Sloane is a surgical registrar and a trained aesthetic doctor. Hi, Dr. Sloane, how are you?
Hi, good morning, Joanna. I'm fine. Thanks for inviting me to the interview.
Pleasure. Wonderful to be talking to you today. Dr. Sloane, today we're going to be talking about botulinum toxin and frequently asked questions that people may have. So I think the right place to start is by asking, why does skin age?
Okay, well, it's multifactorial, but essentially your skin is made up of a number of different molecules. One is called collagen, and this provides your skin with firmness and structure. Then your skin also has other molecules, for example, elastin, which gives your skin suppleness and flexibility. And there are other molecules called glycosaminoglycans, and we can shorten that to GAGs, and that's the abbreviation. And these actually sort of hydrate the skin. They draw water molecules to it and give your skin that sort of youthful suppleness. And as we age, these molecules start to slowly reduce in their content, typically from about the age 20, and these reduce about 1% per year. So you can imagine by the time you're in your 70s and 80s, that content has reduced quite dramatically. So if you add in also effects such as environmental factors, such as toxins in the atmosphere, diets, smoking, and also just the facial expression, use of muscles on the face where we create wrinkles, these will add to the aging process.
What is botulinum toxin and what conditions can it be used to treat?
So botulinum toxin is a substance found naturally in a bacteria called Clostridium bacterium. Essentially, bacteria use this actually as a poison, which has in some circles given Botox a slightly bad reputation. However, it's used in a medical grade form, in a purified form, should I say, to strategically target particularly muscles. And it's used in a wide range of medical specialties, for example, in aesthetics, to weaken muscles and, for example, improve wrinkles. There are different subtypes of botulinum toxin, but the most commonly used is type A, and that's the one that most people have heard of.
How long do the procedures take, and what happens in these procedures?
So a botulinum toxin procedure used for wrinkles essentially would take, on average, 20 minutes to half an hour, depending on if the patient has some background knowledge of what is going to entail and what they want from the procedure. Essentially, we would do a medical consultation, of course, take a patient's background history. Then we would talk a bit more about what they hope to achieve from the treatment, and I would show them in a mirror, for example, what lines can and can't be improved. And then if a patient is happy to go ahead, then we would typically inject certain areas of the forehead and around the eyes to improve the cosmetic appearance of their wrinkles. And this is actually a very quick and painless procedure, typically taking 5, maybe 10 minutes in a slightly more nervous patient where I take more time.
How quickly does it work, and how long will the effects last?
Well, botulinum toxin treatments typically take 7 to 10 days to start taking their effect. So the day after the procedure, you may not notice any difference in your wrinkles. In fact, that would be quite unusual. But slowly, as you reach that sort of 10-day time period, you would notice if you've had a procedure, the muscles feel heavier on the forehead, and they become more difficult to crease, and therefore the wrinkles improve in their cosmetic appearance. On average, I would say treatments last about 3 or 4 months, and then over that period of time, the muscle slowly unfreezes, if you like, and they become easier to use, and the wrinkles start to reoccur. And at this stage, if a patient likes the effect of the treatment, they can have another repeated treatment.
Are there any risks or possible side effects to the treatment?
There are, and all patients who have a botulinum toxin treatment should be properly consented and informed of these prior to having a treatment. There are short-term, sort of more obvious side effects such as bruising, some discomfort because a needle is induced to inject the product. Some people complain of a mild headache, maybe just for a few hours after the treatment. That's not common, but well documented. More serious but rarer side effects include an eyebrow droop, for example, where the eyebrow feels a bit more heavy, or indeed an eyelid droop, where the eyelid can become more heavy. These are uncommon and tend to occur with a poor injection technique, so it's very important for a patient to seek an experienced doctor in the use of botulinum toxin. But also patients should be aware that there are some aftercare instructions that they should abide by. For example, not touching or massaging the face after the treatment for at least 24 hours. They should also avoid alcohol, and they should also avoid going to the gym or doing anything too strenuous, just in that 24-hour window after the treatment, just to let the product settle and take into the muscle.
And just a final question, is botulinum toxin for everyone? Who would not be a good candidate?
Botulinum toxin is licensed in the UK for patients from 25 to 65. So anyone theoretically in that age bracket would be suitable. There are, of course, people with known allergies, for example, to albumin, which is found in eggs. And albumin is one of the products used as a preservative in the botulinum toxin process. So these people, of course, would not be suitable. There are patients who may actually have unrealistic expectations of what the product and treatment might give to them. So again, during the consenting process and pre-treatment process, it's very important to establish exactly what is and isn't achievable with treatment. Some people misunderstand what botulinum toxin is and may not get the benefit that they hoped for. So this is vital in the sort of consultation process.
Thank you. Thank you so much for talking to me today.
That's a pleasure. Thank you.